Hello dear students, welcome to this channel again. Okay, in last few classes we have discussed about the cyanotic congenital heart disease, that is atrial septal defect, ventricular septal defect and patent ductus heart disease. So today I am going to begin with the cyanotic congenital heart disease, that is tetralogy of Fallot. Okay, so let's begin with the tetralogy of Fallot. It is a very interesting conditions. Let's begin. Okay, so what is the definition of tetralogy of Fallot? Okay, so tetralogy of Fallot, it is a cyanotic congenital heart disease characterized by a combination of four defects. What are the four defects here? Pulmonary stenosis, ventricular septal defect, right ventricular hypertrophy and overriding of aorta. First, what is pulmonary stenosis? Okay, so pulmonary stenosis is nothing but a narrowing of pulmonary artery. Okay, so pulmonary stenosis is the one. What happens here? It is a obstruction in the flow of blood. It is obstruction in the flow of blood from right ventricle into the pulmonary artery. It is obstruction in the flow of blood from right ventricle to the right ventricle into the pulmonary artery due to inability of pulmonic wall effluents to open completely. When they are unable to open completely, there is obstruction in the flow of blood from right ventricle into the pulmonary artery. Next defect is ventricular septal defect. Already I have discussed in the last class. Ventricular septal defect is nothing but a abnormal opening between the right ventricle and left ventricle. Okay, so this is known as ventricular septal defect. Next defect is right ventricular hypertrophy. Right ventricular hypertrophy is nothing but a thickening of a right ventricle. You can see here there is a thickening of a right ventricle due to hypertrophy. Next one is overriding of aorta. Overriding of aorta means the aorta should rise from the left ventricle little up from here. But what happens here? When the aorta that rise right from the ventricular septal defect, at the opening of ventricular septal defect, if the aorta rides or a run, so this is known as a overriding of aorta. So these four defects are present in tetralogy of Fallot. Okay. So now let us discuss about the etiological factors and pathophysiology. Etiological factors are same like other cyanotic congenital heart disease what we have discussed in last few classes. Okay, that is a chromosomal abnormality, genetic factors. Okay, so this tetralogy of Fallot is commonly associated with Down syndrome, Turner syndrome, okay, Klinefelter syndrome, and other chromosomal abnormality. If mother consumes excessive alcohol during the pregnancy, that can be contributing for development of tetralogy of Fallot. Or if there is a use of teratogenic drugs during first trimester of pregnancy, or use of if there is infection, teratogenic infection during the first trimester of pregnancy. Okay, or if mother suffer from maternal insulin dependent diabetes mellitus, that is type 1 diabetes mellitus, that can be contributing factor for development of a tetralogy of Fallot. Okay, or if there is any fetal hypoxia, decreased oxygen supply to the fetus during the pregnancy, or if there is a birth asphyxia. Okay, when the baby is unable, when the newborn is unable to establish breathe after the birth. So all those etiological factor what I have discussed in last few disease condition like cyanotic congenital heart disease. So same etiological factors will continue for this tetralogy of Fallot also. Okay, so now we will discuss about the pathophysiology. So next third factor we will discuss about the pathophysiology. So what happens here? Due to etiological factors, there is a four defect. You can see there is a four defects. All these four defects will be there: ventricular septal defect, pulmonary stenosis, right ventricular hypertrophy, and pulmonary stenosis. Okay. So what happens here? Due to pulmonary stenosis, due to obstruction in the flow of blood from right ventricle into the pulmonary artery, what happens here? Due to pulmonary stenosis. Okay. Due to this pulmonary stenosis. So what happens here? There is a obstruction. There is obstruction in flow of blood from right ventricle into pulmonary artery. Okay, why? Because the pulmonary wall effluents are unable to open completely during the contraction of right ventricle. So because of this, what happens here? The pressure and volume in right ventricle increases. It increases. Pressure and volume in right ventricle increases. So pressure and volume in right ventricle increase. Okay, and this pressure and volume in right ventricle it exceeds the pressure and volume in the left ventricle when compared to left ventricle. Okay, so the pressure and volume in right ventricle exceeds the pressure and volume in left ventricle. Okay, that is nothing but the pressure and volume of blood in right ventricle is more than the pressure and volume of blood in the left ventricle. So because of this pressure gradient, what happens here, there is a shunting of blood, from high pressure in right ventricle to low pressure in left ventricle. Okay, so because of this increased pressure in the right ventricle, there is a shunting of blood from right ventricle to the left ventricle, exactly opposite to that of ventricular septal defect. Okay, so due to the pressure and volume in right ventricle exceeds, it is more than the pressure and volume in the left ventricle. Okay, so because of this, there is a shunting of blood from high pressure in the right ventricle to the low pressure in left ventricle. Okay, so because of this, what happens here, there is decreased pulmonary blood flow. So there is decreased pulmonary blood flow, that is decreased blood going for the oxygenation of gas. Okay, oxygenation of blood. So because of this decreased pulmonary blood flow, what happens here, decreased oxygenated blood comes to left side of heart, that is left atrium and left ventricle, and decrease oxygenated blood go for peripheral perfusion. So overall, this will what happens here, there is a cyanosis. Okay, there is a, why cyanosis? Because there is a decreased oxygen concentrated blood go for the peripheral tissue perfusion. So because of this, the baby will develop a cyanosis. That is why it is called cyanotic congenital heart disease. Okay, so overall, when you want to have a review of this pathophysiology, so what happens here, due to etiological factors, okay, that will lead to 4 defects, that is pulmonary stenosis, ventricular septal defect, right ventricular hypertrophy, and overriding of aorta. Okay, so because of this pulmonary stenosis, there is an obstruction in the flow of blood from right ventricle into the pulmonary artery. Okay, so because of this, what happens here, the pressure and volume in the right ventricle increases. Okay, and the pressure and volume in the right ventricle, it exceeds the pressure and volume in the left ventricle. So because of this, what happens here, there is a shunting of deoxygenated blood from right ventricle to the left ventricle. Okay, so there is a movement of blood from right ventricle to the left ventricle. Okay, so because of this, what happens, less amount of blood go for the oxygenation, less amount of blood go to the lungs for the oxygenation, as there is a shunting of blood from right ventricle to the left ventricle. So less amount of oxygenated blood come back to the left atrium and then to the left ventricle, that is the left side of the heart. On contraction of left ventricle, the oxygen there, though there is a good stroke volume and cardiac output, but oxygen saturation is very less. So because of this, there is a less oxygen supply to the peripheral tissues, that will lead to cyanosis. Okay, cyanosis is nothing but a bluish discoloration, that is due to lack of oxygen supply to the peripheral tissues. Okay, so that is what happened. Okay, next, on other side pathophysiology, due to etiological factors, what happens here, there is a 4 defects will be there, and mainly because of pulmonary stenosis. Okay, mainly because of pulmonary stenosis. So what happens here, there is an obstruction in the flow of blood from right ventricle into the pulmonary artery due to inability of pulmonary wall effluents to open completely. So because of this pulmonary stenosis, what happens, the pressure and volume in right ventricle increases. Okay, so because of this, what happens here, right ventricle, already I have told you, right ventricular hypertrophy and hyperplasia. Then what happens here, this right atrium is unable to empty the blood completely into the right ventricle. Okay, so this will what happens, right atrium unable to empty the blood completely into right ventricle. Okay, So finally what happens here? The pressure and volume in the right atrium also increase. Finally what happens here? The pressure and volume in right atrium also increases. So this will be what happens here? Right atrial hypertrophy and hyperplasia. Okay, so that is leads to right atrial enlargement, and finally what happens here? There is a backflow of blood from right atrium to superior vena cava and inferior vena cava. So this will lead to what happens? Peripheral edema. So when it comes to second pathophysiology of tetralogy fellow, so what happens here? Due to etiological factors, there is 4 defects. Okay, especially due to pulmonic stenosis, there is obstruction in the flow of blood from right ventricle into the pulmonary artery. Okay, due to inability of pulmonary qualifiers to open completely. So because of this what happens here, there is obstruction in the flow of blood, and that will lead to the pressure and volume in the right ventricle increases. Okay, and right ventricle hypertrophy and hyperplasia, and right ventricular enlargement will take place. And later what happens here? This right atrium is unable to empty the blood completely into the right ventricle. Okay, and then what happens? The pressure and volume in the right atrium also increases, and right atrial hypertrophy and hyperplasia. Finally, right atrial enlargement also takes place. And finally, what happens here? The blood will start going back from right atrium to the superior vena cava and inferior vena cava. That will give rise to development of peripheral edema. Okay, so this is the pathophysiology of tetralogy of Fallot. Now let us discuss about clinical manifestation of tetralogy of Fallot. Clinical manifestation. So clinical manifestations, mainly we have a cyanosis. Okay, that is a bluish discoloration. Okay, there is a cyanosis. Okay, bluish discoloration of skin. Okay, lip, nail, and tongue. Okay, so that is okay. That bluish discoloration will be there, and we can also see there is a tet spell. Okay, tet spell. Tet spell means the baby will turn. The baby skin will turn into blue. Okay, the skin, nail, lip, and tongue will turn blue after feeding or after crying. Okay, so after the crying and feeding, the baby nail, lip, tongue, and the skin will turn into bluish discoloration. So this episode is known as a tet spell. Okay, and apart from this, what are the other manifestations? There is the child will have a mental slowness, restlessness, irritability, lethargy, confusion. Okay, so all these mental slowness, restlessness, irritability, lethargy, and confusion, it is because of lack of decreased oxygen supply to the brain. Okay, so because of this what happens here, there is a change in the mental status, change in the cognitive functions. Okay, and some changes, CNS manifestation we can see in the child, that is mental slowness, restlessness, irritability, lethargy, and confusion. Okay, next what else the baby will have? There will be peripheral edema. Peripheral edema will be there because of backflow of blood from right atrium to the superior vena cava and inferior vena cava, and there will be tachypnea, increase respiration rate. Okay, tachycardia. Okay, then there will be shortness of breath. We can say shortness of breath. Okay, mainly the cyanosis will be present in case of a tetralogy of Fallot, as this is a cyanotic congenital heart disorders. Okay, so this is all about the discussion for this video. In next video we will discuss about the diagnostic evaluation and management of a tetralogy of Fallot. Thank you.